Hello everyone, we are here doing our pelvic pain series with Dr. Rob Graziano. Thank you again for being here and for answering our questions. If you want to listen to the past two series, just go back to our social media at Beyond Basics PT and listen in and hear the wonderful things that Dr. Graziano has to say about his journey, his symptoms, and how he got better, how he treated himself, and the multidisciplinary approach that he went through. So thank you again for being here. Our question today is, what specifically would you tell male pelvic pain patients about diagnosis and also about what to look for and what you found most helpful?
I think the important thing is to make sure that you get treated as early as possible. A lot of men are reticent to even going to a doctor with pelvic pain because they're figured, well, it's something down there, and they just want to ignore it. And the thing is, it's not going to go away on its own. So you have to pay attention to your body and not be afraid to go to the physician and say, you know, this is what's happening, because the quicker you treat something, in all likelihood, you're going to get better quicker. So I would just, see what your symptoms are and then go to the doctor. And if you're not satisfied with his response or her response, then see another doctor. I mean, I think the important thing to mention here that wasn't mentioned earlier, that men with pelvic pain, 90% of the time, it's due to pelvic floor dysfunction and problem with the muscles. It's not bacterial. And a lot of urologists may prescribe medications, but as soon as somebody walks in the door, you should know 90% of the time it's gonna be a bacterial prostatitis, which means non-bacterial prostatitis that needs to be treated differently. And if you're seeing a doctor who says, here, take this antibiotic, maybe you could start with that, but my gut feeling is 90% of the time that's not gonna be right, so maybe you have to look for other alternatives. Maybe find a different doctor and say to that doctor, are you comfortable in treating men with, it's called type 3 prostatitis, but that's non-bacterial.
Right. No, we see that a lot in our practice here, and just to go through some of the symptoms that we hear from patients, Dr. Graziano's main symptom was genital pain, specifically penile pain and burning. That was, as he described it, unrelenting and all day long. Some of the patients will complain of that. They may complain of testicular pain, rectal pain, some describe it as a rod up their rectum, which doesn't sound pleasant, but typically that is a muscle spasm that's going on. And other symptoms, just so our listeners are aware, is urinary and bowel frequency, urgency, retention, incomplete emptying, and hesitancy. Or with the bowel, it's just incomplete emptying, or they end up constipated because the muscles of the pelvic floor aren't relaxing. So that is what we do as physical therapists, is we help to lengthen the muscle and work on relaxing the muscle through breathing techniques, through stretches that Rob explained earlier, that he did at home from my book, Heal Pelvic Pain. And those are just some of the symptoms, and it overlaps with some of the bacterial prostatitis symptoms, so that's where it gets confusing. But as you said, 90% typically is non-bacterial, where you don't need antibiotics. And what the primary thing that we find helpful is pelvic floor physical therapy with an expert therapist, and also sometimes medication is needed, and behavioral modifications at home as well. Is there anything you wanted to add?
Yeah, the thing that I've read, penile pain happens to be the most common symptom for men, and even when they have sexual activity, I've experienced it, and it's been in books that you'll have pain with that as well. That's something that's not mentioned a lot, but it happens. And
right, I didn't mention that.
It's part of life.
Yeah.
And I have.
Did you have symptoms? So some with sexual activity, some, sorry to interrupt,
yeah.
but some complain of during the activity or after the activity is when they get their symptoms of burning or urinary frequency, urgency, incomplete emptying. We see males with premature ejaculation as well as inability, and there are other conditions that there's a lot of conditions like Peyronie's disease that they actually get injured in the penile area. So there's a lot of things that we can help with. Was there something specific that you experienced, if you don't mind me asking, with sexual activity?
The bottom line was, I just have pain all the time. So, as expected, during sexual activity, I would have pain as well.
Yeah.
So it's not uncommon, and it's just, and I was told by Dr. Patari to expect that as well. So it's common. You're in pain all the time. The other thing that I'd like to add, that I've heard horror stories of men having a testicle removed, pelvic surgeries. One guy even had rectal pain and had a colostomy. That is just crazy when and of course they never felt better. That wasn't addressing the main issue.
Right. So
you're just in this unrelenting pain that you have to get the right treatment, and physical therapy was the way to get you better.
Yeah. One of my earliest, or I should say my youngest and first patient that was that young, an 8-year-old boy, he came, and I had never treated kids before, but the mom came in just determined, because she was told that he was going to have a sphincterotomy, where they actually remove his anal sphincter, and it was pelvic floor dysfunction. He was having pain and abdominal pain, nausea, even vomiting because he wasn't able to empty well. So it's scary, but fortunately we're getting the word out there more. That's the reason we're doing this, and I so appreciate you being here, because people need to hear people like you talking about this, and everyone truly appreciates the contribution that you're giving to our society. So thank you so much. Stay tuned for a couple more questions that our wonderful Dr. Graziano, it will be answering in the next series. Thank you so much.